You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic. He says nobody should be wearing a loose-fitting denture. With us, Dr. Johnson. Dr. Johnson, welcome to the program.
Hey, thank you. Glad to be here.
Now, for people that don't know your practice, who's your typical patient? What are the different services you offer? I guess you do more than just dental implants, but that's your focus, right?
Right. So we do a full range of dental services. It's an adults-only practice. We're located in the Ozarks of Arkansas, but we serve the entire state of Arkansas, southern Missouri, Oklahoma, Tennessee.
People really drive that far to see you?
Yeah, they do, Randy. And we do some unique things that, I think the main thing is we do a lot of things under one roof. So some of these more complex cases, we're going to talk about implants and things, a lot of times people are getting sent to multiple offices. We're doing everything under one roof.
Right there.
Yeah.
Okay, now when it comes to implants, I guess the way it's normally done is you go to one doctor that's the surgeon that puts the implant in, and then you go to another dentist that puts the tooth on top, maybe somewhere else for the imaging. You do it all right there.
Exactly.
Aside from convenience, is there any advantage to doing it that way?
Absolutely. It just gives better outcomes. And I could go on and on about the advantages, but it's also much more convenient for the patient to have everything done in one place. So much better outcomes, start to finish. Everything's focused on the same goal of getting a great result.
Okay, now I'm trying not to categorize people, but I guess there's two main type of people. People that their teeth are really bad, right? And they may be headed to dentures. Then there are people that are already wearing dentures. Is that the typical patient that comes in for dental implants? Yeah,
exactly. And that's a big focus of our practice, is helping people with existing denture problems. And dentures can be a huge problem.
You don't like them, by the way, right?
Well,
traditional dentures?
Yeah, traditional dentures. It's just, I know that there's something so much better. And even the best made denture that looks good and fits as good as it can, it's not, by a factor of 10, there's less, when somebody loses their teeth and goes into a conventional denture, I mean, they lose 10 times their biting force. The problem is there's nothing holding that denture in. You can't really tear a steak. You can kind of simulate chewing, and it's better than nothing, but you're not really chewing your food like your food is meant to be chewed. And so dental implants completely changes that. Now there's something where those teeth are locked in place and the chewing power is back. And actually, sometimes you can get more biting force with implants than you can even with natural teeth. So it's a huge leap forward in what people can eat, their confidence level. You won't believe some of the problems that people have with conventional dentures.
And by the way, are there a lot of people where you are that are wearing either an upper or lower denture, or they're headed to dentures? I mean, is this like a big problem where you are?
So in my area, there's everybody knows Razorback Stadium. You could fill Razorback Stadium several times over with the amount of people with dentures or heading to dentures. So it's a pretty huge problem.
So if it's so good then, what's your take on why they're all not doing it? Why aren't they coming in to get their teeth, I guess, attached to dental implants?
There's a lot of reasons for that. But one, when somebody has dentures, they're really out of the system. A lot of denture wearers are not going to the dentist on a regular basis. And so nobody's telling them what their options are.
Okay.
The second thing, if you understood the life of somebody what their life was like before they wore a denture, oftentimes there was 10, 15 years of continual dental problems. Root canals, extractions, root canals that didn't work, crown work, fillings, bad breath, gum disease. And it becomes, for those people, when they finally have their teeth extracted, it's a relief. And so the last thing they're thinking about is new dental procedures.
They don't want to go see you.
They don't want to go back.
Dentist. Is that true?
What's that?
Do you hear that, by the way? Like, no offense, doctor?
Yeah. Well, sure. It's not there's better things you could do with your day, but when you get your dentistry done right and get it solved, it's one of the most powerful things that you can do for yourself.
Now, one of the things you say is that on the day of the procedure, people could actually walk into your office with no teeth, walk out with teeth, full arch of teeth.
Absolutely.
Is that right?
Happens
Is that common or every once in a while?
Happens every day. Let me show you a case.
Okay.
This is a woman. We just saw her last week. And here was her before picture. This is basically what she looked like the day she came in. Her smile had been holding her back for years. She was telling me, hey, I know better. I'm in healthcare. I should have been doing something with my teeth, but she hadn't. But it finally got to the point where that problem was big enough that she was ready to do something about it. And so that is her new smile. And that was the smile she got the day that she came in for the procedure. She left like that. The picture was taken 2 days after at a post-op check.
So she was headed for dentures, right?
Yes, absolutely.
So she didn't want dentures.
She did not want dentures. I mean, she's young, active, energetic. She scuba dives. She couldn't have teeth that come in and out. So I mean, her treatment plan is based on, we want teeth that are fixed and stay in.
How old can you be to get this done, by the way?
Really, there's no age limit. I mean, I have patients in their 70s, 80s, 90s.
Really?
Why
would they want to do it, a 90-year-old?
Well, Randy, they're just like you and me. I mean, they want to eat.
Okay.
They want to chew. They want to smile. They want to enjoy their time with friends. So, and that doesn't change at any age. And actually, it can become more important with age. I mean, it's a huge advantage as you're later in life when you have a good, solid solution for your teeth. I mean, the quality of your life goes up dramatically. And what I see is sometimes after like 1 or 2 appointments, after the consultation and exam, they just start to loosen up, and their fear goes way, way down. And we offer sedation. There's a lot of ways.
So they're comfortably sedated when this is done. It doesn't hurt while it's being done.
Yeah, I mean,
it seems painful, by the way.
No, actually, this is a procedure. I get this consistently from patients. They think, Doc, I had this done, and I thought this was going to be this big implant procedure. And I talked to them the next day, and they're like, hey, I'm feeling pretty good. I mean, it's much less than people anticipate.
We're going to take a quick break. We come back, more about the process, what people can expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I couldn't smile and show my teeth. It was, not even my family knew how bad my smile had gotten. My personality has blossomed over the last year. It has literally blossomed to what I used to be when I was young.
People ask, are you approaching 40 instead of 70? I feel much younger. I feel much more confident.
My upper denture would fall out. And then I'm in a restaurant and chew on something, my denture would fall out and everybody would see it. Well, I can eat everything. I can eat apples, I can eat corn on the cob, I can eat steak without having to grind it up. And it's just a good feeling that I know that if I go out to eat, I can eat anything I want. I can smile now. I feel more confident. I can go anywhere I want. I can eat where I want. I can go out where I want. I can smile at people now. I don't have to walk with my head down so people don't see my teeth.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my guest, he says nobody should be wearing a loose-fitting denture. They should be, I guess, secured by dental implants, right? That's what, I don't know if I put words in your mouth here.
In this day and age, dental implants are such a major advance that denture problems should be a thing of the past.
But isn't it true, though, that if you've been wearing dentures 30 years, right, that you don't have enough bone for dental implants?
That's not true. Almost all cases we can help people with who've had dentures no matter how long. And people might have been told that. It's a very common thing that they're told, but oftentimes they're told that from a dentist who doesn't do a lot of implants or doesn't have a lot of implant experience, or maybe doesn't have the imaging techniques that we have that can show us exactly where the bone is and where those implants can go.
And you believe that you're really transforming people's lives. In fact, you say in one day, their life's changed. Elaborate on that.
Well, I tell you, probably the best way I can elaborate is, is just, I'm telling you what patients are telling me.
Okay.
And so, here's another case I want to show you. And, this is a woman who, she had some loss in her life. She is an incredible lady, and she actually had tons of friends in her life. And she was telling me this story that her friends would call her and say, well, hey, let's take you out. We want to cheer you up, and let's take you out to dinner. And she was actually turning down the amount, all the support that she had in her life because she was ashamed of her teeth. So with her, I mean, her teeth were heading south pretty fast. And obviously it was affecting her diet, but the main thing was affecting her socially, where, I mean, she wasn't connecting with the people that she wanted to connect with. So let's take a look. So what we did is we saved the teeth that we could. We used dental implants to rebuild her upper and lower arch of teeth, and take a look at the after, and you know, that's what I'm talking about as far as giving her smile back. And it's more than giving her smile back. This is about, giving her full life back. I mean, engaging in life. She is eating the foods that she wants. She's eating pizza and salads and fresh fruit and fresh vegetables.
Can she bite like a carrot with her front teeth?
Absolutely. No,
so whatever you want.
No restrictions. There's no restrictions. I mean, the same restrictions the same limits I would have for somebody who had their natural teeth. Like, okay, don't bite your nails or things like that. But there's no restrictions. This is just like her having her natural teeth back. And you know what we always do, Randy? We do, I see people before they come in, we do a consultation, and then we do an interview when we're done with the case, because I want to make sure everybody's completely happy and we met their goals. And we have a clip. And she describes some of these things we're talking about.
Let's go to that clip. Okay, so she's basically talking about the benefits of her new teeth. Okay, let's take a look at that.
This smile is mine, and these teeth are mine. They're not something I take out at night and put in the morning. I love that I can look at a picture taken of me and see those white teeth, and they look so good. I love that. I don't have to hide from anything. And there's plenty of times in your life to cry, but man, it's so great to smile.
It's very nice.
And Randy, that's common. And I have over 100 videos. You can go to my website. I mean, this very typical themes that happen when somebody gets this type of work done. And I'll tell you, another thing that people tell me is when they get this done, the biggest regret they have is that they didn't do it years ago.
Is that right?
Yeah, and let me show you another example here. So this is Charlie, and I absolutely love Charlie. He's a great guy. He and his wife are great patients. And the interesting thing, when I got done with Charlie's case, we sat down and talked to Charlie, but the interesting thing is when we talked to his wife, and his wife tells me, she says, I feel like I got Charlie back. Charlie's personality like it was 20 years ago. And he's a guy that his mouth kind of just slowly got into trouble over time, and he didn't realize how bad it was getting. Take a close look at the before-after picture. Which guy there is more energetic, happier, has more vitality?
That's true,
yeah. I've seen this, I've been doing this for 20 years, and I see this pattern, and I call it the ripple effect.
Okay.
And it's like, sure, we're changing the teeth and smile, but it creates this ripple effect. And you wouldn't believe the amount of people, like we get this done, it changes the look of their face, they get more confident. A lot of times they'll get on exercise programs, or they'll stop smoking, or they kind of use this as this launching pad to improve all these other areas of their life. And that's what I mean by the ripple effect. I've had a patient who, she came to me really down about her smile, depressed. Within months after getting her smile done, the same type of work, she got off antidepressants. She met the man who later became her husband. I mean, it just energized her life. And when somebody's holding back their smile, or they have problems with their teeth, it can be a huge obstacle for them to just live their life. And it takes a lot of energy to hold back a smile, or to not go out with friends because you're embarrassed about your denture or partial coming out.
So that's common. I mean, there's a lot of people that feel this way.
Yeah. So this is powerful. Like when we can solve that problem, and that's no longer an issue in their life, it's huge.
If somebody's about to lose all their teeth, right?
Right.
Or they already have a denture, and they're in your office, what are their options when it comes to dental implants?
Great thing about dental implants is there's a wide variety of ways that we can use dental implants. So on the simple side of things, just 2 dental implants, and we can convert that denture. All of a sudden we have something that snaps in, snaps out. Now they can eat. They don't have to worry about denture adhesive, their denture moving around. So stabilizing a lower denture with just 2 implants.
You do a lot of that?
Do a lot of that,
okay.
Absolutely. Moving up from there, adding 4 implants. I mean, this is a whole nother level of stability, and you can do that snap in, snap out. We can eliminate dentures altogether. So nothing comes in and out. There's no palate. So now, when someone has a denture, it covers their mouth. They can't sense the temperature, the texture, the taste of food. So adding implants, getting rid of that upper denture, getting rid of the palate, all of a sudden now, I mean, the flavor, texture, temperature of that food is back. So it's a
permanent set of teeth on the lower. How many implants for that? If everything works out.
Ideally, you can do as little as 4 implants to have a fixed lower arch.
So a full arch of teeth.
Yeah.
Okay. That don't come in and out. And then the upper?
And the upper 4 to 6 implants, as far as if we want something that doesn't come in and out, anywhere from 4 to 8 implants. But 4 would probably be the minimum on the upper. So when we give people a permanent set of teeth that don't come in and out, they can eat whatever they want. I mean, we're talking, you name it. Steak, nuts, fresh fruit, carrots. It's like getting your teeth back again. I mean,
do they tell you eating stories? Like,
oh yeah.
Are they afraid to eat at the beginning?
Well,
where they say, hey,
they're so conditioned to thinking that they have to like pick and choose on a menu only certain things that they can eat, that it's they have to get some practice in. Oh my gosh, the sky's the limit. So and then they can just chew and digest things so much better. So and there's a lot of people who have digestive problems and have dentures because they can't chew their food, and that's one of the most important steps in digestion is being able to chew. So beyond just a smile, I mean, just from a health standpoint, it's a pretty critical thing.
Is it more women that do this or more men?
Oh, I mean, it's really 50-50. I wouldn't say more one than the other. Sometimes men, it's interesting, men come in and it's more of this functional thing and they want to eat, but then what happens is they get their smile and they're functioning fine, and then they start to get compliments from women about, you're smiling more, you look so much better, and they get so, they didn't come in for the smile, but they're so happy. That's the part of the case sometimes they're most happy, the happiest with. And then also the reverse is true, where women will come in and they really want to look younger and smile better, and then they find out how much more that they can eat and how much more enjoyable food is.
You say it's like a third set of teeth.
Sure, yeah. So there's your baby teeth, and then if your adult teeth don't make it, that's where dental implants come in. And that can be your third set of teeth, yes.
Now, we were talking in the green room, and it's almost like you spoke with frustration that dentistry is a lot of patchwork. And the dental implants now, it's like you're giving people something back.
Right.
Can you elaborate on that?
Sure. I mean, I see that a lot. I mean, people will come to me, and they've been in a cycle of dental problems. Like, every 6 months, something's breaking or
it's a lot of
hurting,
money, too.
Yeah, it is. It's like a money pit for them. And so, I mean, the thing we do different is we really help people get a strategy. It's like, let's solve this thing that you've been dealing with for the last decade, and let's get it so, I mean, you can get a result today, but let's build this result to last and end this cycle of dental problems.
And some of these people, I mean, you do same day. Like, they come in with no teeth, and they walk out with teeth.
Yeah, they always walk out with teeth. I mean, this is.
So you're never without teeth.
Right. Let me show you a case here.
Okay.
So this was a patient, a great lady, and she had so many gifts. Public speaking is her gift. And that's what she'd been doing her whole life. And she'd been helping veterans and working with the American Legion, and her mouth was slowly falling apart. And it got to the point where she wasn't doing public speaking, she was passing on jobs, speaking engagements, things like that. And actually that before picture, right before we started, another tooth had came out like a week before we planned to start. And that picture I'm showing you, that picture was taken a week later, but she looked like that the same day. So when we do this work, we have the whole case planned, the teeth are built, the day you have it done, you have a smile on that day. And so that's a fixed set of teeth there. She doesn't take anything in and out. And that's her picture a week later. And you can see her. I mean, just look already what happened to her personality.
I mean, they do look, I mean, she looks different.
Yeah.
Almost a little bit like two different people.
And her career's back. If she's back, she's got a promotion. She's back speaking again. So I want to show you another case, and I want to show you the health effects, because we do everything we can to help people save their teeth, but there comes a point when the teeth can get so diseased, I call them toxic teeth, and this is infection in your mouth. And if you think about it, your mouth, I mean, this infection gets into your bloodstream. I mean, you're swallowing things.
So it's a bacterial infection in the mouth.
It's a bacterial infection. And so I want to show you this case just to touch on that because it's so obvious. This picture is taken about 3 months apart. But just take a look at the before picture. Just take a look at the eyes, the skin tone, the teeth. And then we handled that infection and take a look at the results there. Looks like a new guy, doesn't it?
Yeah, it does.
Yeah, absolutely.
I mean, it really does.
Yeah. And a lot of his health problems were centering around this disease he had in his mouth.
So this infection lives on the teeth that are...
Right.
And when you take them out, the gums get healthy?
Exactly.
So your gums can't be too unhealthy to get dental implants?
No.
They're not more likely to fall out when you have bad gums?
No. When the teeth and disease is removed, that's where the bacteria is collecting, is on the teeth. So when the teeth are out, the infection's out. And just because somebody has periodontal disease or disease in their mouth doesn't mean they can't have dental implants. That's not true. They're actually a great candidate. They're one of the best candidates for dental implants because that's the best option available for them. Yeah.
Doesn't look like the same guy.
Doesn't look like the same guy.
Almost more educated.
Yeah,
I'm not trying to side with you, but when I look at this, it is a big transformation.
Yeah, and you look at some of these cases, and people really they can get discriminated against because...
What do you mean by that, discriminated against?
Well, people judge people by how their smile looks.
Like maybe they don't have money or...
Yeah. Or,
interesting point.
Yeah, just imagine, some of these pictures, I mean, we look at them together, but as far as, okay, which person's gonna, get the job promotion or get the loan, or people make judgments about other people by, how they look, and a smile is a central part of somebody's face. And, just look at the studies as far as attractiveness in a mate. It's always right on the top of the list. Smile, eyes. Yeah. These things are the most attractive features that people look for. And so it's a very powerful thing when somebody's now smiling and confident. I mean, it's
like charisma's tied to that smile.
Yeah, absolutely. Absolutely. I mean, it really, that's what lets your personality really, really shine. Here's another case I want to show you. She had some health issues that were jeopardizing her teeth. Some teeth needed to go. We could save some. We used dental implants. So she has a situation where nothing comes in and out. She's got her smile back. She's got her mouth back. Hey, I have plenty of cases. Do I have time for a couple of more?
2 more, because we have about 2 minutes left.
Okay. This is a patient here. She came to me. She had been hiding her smile. She had a set of dentures. She wasn't happy with how they looked, how they felt, what she could eat. She was finding herself hiding her smile. We rebuilt her smile. We used dental implants to support an arch of teeth. Now she went from hiding her smile to now she's getting compliments about her smile. I mean, her mouth and smile is like a source of compliments for her. So in one afternoon, Randy, her life's transformed.
Very nice. We're going to take another break. We come back. Probably time for one more photo. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
The difference between dentures and implants is like night and day. I couldn't eat pizza before, ever since I had dentures. 35 years or plus, I haven't been able to really eat pizza. Now, with my implants, I can literally bite off a piece of pizza and chew it on one side or the other, and they're not going anywhere. My confidence has just escalated. I got my face back. I got my smile back. The first time I got the implants and my husband looked at me, I hadn't seen that look in his eyes in a long time. And that just absolutely warmed my heart. And I thought, yeah, if nothing else, that was worth it.
You're watching The Wellness Hour. I'm Randy Alvarez. We're discussing replacing missing teeth with dental implants. Okay, so you can get this into your 80s, 90s years old. You could go in and get a fixed set of teeth. The implants aren't more likely to fall out if you're older?
No. Age, this isn't, there's not age restrictions on this. I mean, basically somebody has to be in decent health, of course, to have any procedure done, but there's no age restrictions. I mean, example, this is Warren. He is 93 years old. He came to me And yeah, he had a lot of trouble with his teeth, and I wasn't quite sure, you know, at 93, okay, what's the best thing? He told me, he said, look, he said, I've seen what you've done. He said, he says, do what you can do with my teeth. And at 93, he knew what he wanted. But this is an interesting case. Look at this before after in detail, and look at his eyes.
Yeah.
Look at his skin. Look at his posture. So with him, we gave him a full upper and lower set of teeth. Nothing comes in and out. He can eat what he wants. So when these patients, they see their teeth for the first time, like this reminds me of a story. I talked about the case earlier, but I sat the patient up in the chair and I gave her a mirror, and she took a look at her smile for the first time, and I could just see it in her face. I mean, it was a really powerful moment, and just a tear welled up in her eye, and she was so happy because she knew this was like the first day in the rest of her, you know, for the rest of her life. This is
like a new beginning.
A new beginning for sure. And nice. Then it's great. You know,
do people want to hug you? I think you told me they want to hug you.
I get lots of hugs, and
really?
that makes my day. And so anyway, yeah, I mean, I really love what I do. I'm passionate about it, and those things definitely make it all worth it.
So we should mention, I guess, Medicare, Medicaid, and we're out of time, but Medicare, Medicaid does not cover it here in the U.S. Insurance doesn't cover the whole procedure for dental implants, but you offer financing in your office?
Yes, we do offer financing. I have a person in my office. I mean, her job is helping people find a way to do this, as far as we want to make sure it's done in a budget that they can afford. There's financing available. And that's why I said there's different ranges of treatment plans. And so we can find something affordable for just about everybody.
Okay, good. Final message, somebody watching this, maybe they're still afraid. They're worried about pain. They think they're too old, or their teeth are just falling out. What do you say? What's their first move?
You know, one thing is, you know, we've been talking this whole show about dental implants, right? But what we're really talking about is enjoying the most important things out of life, enjoying laughing, connecting with friends, kissing your wife, dating, being active, being confident, eating the foods that you want. I mean, this is what we're really, really talking about. And so, you know, the reason I'm doing this show is I want people to know that there's help out there for it. And even people who think that their situation's hopeless.
Is it a free consultation?
Consultation's free. There's no charge for that.
Do they get to see you?
Yeah, we sit down with me.
Okay.
We talk about their dental situation. I give them an idea of what their options are, and we go from there.
How soon can you tell them with predictability or certainty that they're candidates?
That day.
That day.
That day.
Okay, good. I want to thank you for coming to the show. Very good. Very interesting. And they can go to your website, look at these photos, find out more.
Absolutely.
All right, thanks. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.